Bismillahirrahmanirrahim. Allahumma salli ala Sayyidina Muhammad. Allahumma salli ala Sayyidina Muhammad. So thank you so much to all, and especially to the organizer. So I am Dr. Zuraida Zainul, which is from Malaysia. So I've been in dizzy clinic and vertigo clinic for 16 years. So I really hope you are not dizzy with my lecture, inshallah. Alright, so basically, I think management of balance disorder and vertigo is very complicated and unresolved and discussed all over the world without end point. And the most important thing, there's a lot of conflicts and research that may involved in terms of like diagnosis and also the treatment. And I don't know, if you look at in Malaysia also, they are only dependent on the medication, not exercise. And compared to Europe and UK, they are more prone to the exercise, which is balance exercise can improve the balance without medication. And when you are talking about the selections of the treatment, the central and peripheral vestibular disorder is undoubtedly is a very important. If not, you're going to have a wrong diagnosis and wrong management, and you're going to have long-lasting vertigo patient in your clinic. All right, then there is a lot of research shows that the physical exercise has been shown to improve patients with peripheral and also central vestibular disorder. Okay, if you can see here, this is like one of the survey, epidemiology survey among 70 million. And if you can see here, the follows our conference or our WIHU theme this year, the geriatric. You can see here there are a lot of like aging prevalent 74 to 94 years are commonly affected, dizziness, vertigo, imbalance, and even post-stroke people. So you can see here, from this graph, pre-syncope, floating sensation, feeling like on board all the time, imbalance, and vertigo, 80% or what we call that majority needs balance exercise, apart from BPPV, which is what we call benign paroxysmal positional vertigo. I'm so sorry, this is quite complicated, but I think I love this chart because I can conclude here, if you can see, here, the majority, the orange color is actually acute vestibular syndrome. It includes benign paroxysmal positional vertigo, which is existence of the otoconia inside the posterior canal, 85%. The rest can be anterior canal and also lateral vestibular or lateral semicircular canal. And the rest, they can be lots of things. Okay, so when you're talking about dizziness and vertigo, this is what I'm only emphasize. The most important thing, D-sulfide test is a must. D-sulfide test is safe. You just need a clinical skill and you need to confirm whether this patient having BPPV, benign paroxysmal positional vertigo, or non-BPPV. The common symptom for BPPV is very common. When you are waking up from sleep, whatever deep sleep or low sleep, they're going to have like a positional vertigo for a few seconds. No hearing loss. And after that, they can go to shopping, they can go to play football. They are only related to positional related, which is when lying sleep and waking up from sleep. So this is typical BPPV. For non-BPPV, they are very different. They are not related to waking up from sleep and lying down. So that's the reason why I'm saying Dix-Sulfide test, a very simple test, need to do in all vertigo patient, in all dizzy patient, in all imbalanced patient. Alright? So when you're talking about management, if a patient is BPPV, the best method is actually, it depends whether posterior canal 85%, the most common one. So you can do Epley maneuver, but in Europe, they do this more than 10 years. So the best method is actually Siemens maneuver that I can show the video after this, and Gunn CRM, which is done by Professor Richard Gunn from American Institute of Balance. It's quite simple like Epley, but they are shaky. So I will show the video. I'm very happy to show that. I'm not going to make you more dizzy after my lecture. Alright, so this is the video. Alright, so this is my balance rehab clinic for 16 years. I'm with University of Science Malaysia under neuroscience. Alright, so this is what we need to do. This is a treatment for posterior canal. This is what we call Siemens maneuver. Okay, face out. You have to turn the head contra side. If the affected is on the left, turn to the right, face up, face down. And you see the nystagmus, yeah, it's a posterior canal BPPB. It's a rotary upbeating. Alright? You can say anything. You can ask them to do like Ashhadu an la ilaha illallah or whatever, just to make them calm. Alright? You just wait. In vertigo patient, you have to do very polite, very slow. Don't need to be rushed. Alright? If not, you're going to be a zero patient in your vertigo clinic. Alright? Alright. And then we're waking up. That's all. This is very simple. This is the reason why I'm saying here, Seaman maneuver is applied in UK. Aptly is not being used for more than 10 years in Europe. Alright, welcome. Alright, next. So you can see here, when we conclude, the BPPV, benign paroxysmal maneuver, is actually maneuver. The rest, balance exercise. But if you don't forget, you don't know about the balance exercise, you just remember prayer. Solat. Okay, so our life is more simple. If you are dizzy, if you are not BPPV, pray. Don't leave the pray, do the exercise. And inshallah, I'm going to show you the video that how we make a prayer as a therapy. Okay. Okay, this is what I'm talking about, revolution. My topic will be the revolution. So if you can see here, okay. Okay, you can see here, the first model is actually a sheet of paper. You can imagine what your patient will do if you supply them a sheet of paper. This is what we call cotton coopsie exercise. This is world standard. It's very good exercise actually. But the weakness is actually they don't have in form of book, they don't have in form of poster or video. So it's going to be a lot of error. Especially for aging people. They are so, it's not their time to read and to do something. So we are, as a clinicals, need to be innovate. So Cotton Coopsie by Dr. Cottons and Dr. Coopsie by 1984, which is 31 years ago. Okay, so when I'm doing the attachment in UK on 2006 and 7, Alhamdulillah, from that experience, I can learn the second method, which is that we call customized cotton coopsie exercise. But they are still in a sheet of paper. You can Google. You can just put customized cotton coopsie exercise. You can see and print what the kind of exercise. So next step, what I'm saying in revolution, Professor Marisa Paula from Imperial College London, they make a study on simulator based. It's kind of like you introduce a disco light room for your patient. This is a really good therapy. Not ask people to go disco, no. But I think I'm saying to you, the disco room is quite good therapy for those who are having visual vertigo. That means they cannot see the faster light, fast movement, and all those things. Then, it's coming our innovation. Actually, I love innovation. The reason why, when I back from UK, I'm only given one bag, one pillow, and one blanket. So I don't have anything. So start from that. Start from the weakness and the lackness. We already have our own innovation. We innovate and we do in form of poster, book, and video. And after that, you can see the Chinese also doing the virtual reality. This is on 2010, and I'm also having my own disco room actually. Small disco room like changing room because it's very cheap. You can just buy a simple disco light, dark room, and you ask the people to do exercise and put some trampoline. So, because the basic concept for vertigo management, the more challenge, the more faster recovery. Okay? Then, I'm having one of the innovation that involve using car tube platform. So we just add them to stand on that car tube and they do the management and they have a guide. After that, so this is the revolution, what happened. From a sheet of paper, we innovate, we try to help people to make people able to do this thing all at home. This is our purpose, alright? So, when people ask him, sometimes they will ask, what the benefit of the exercise? This is the fourth, the most important theory: plasticity, formations of the internal model, learning of limit, and also the sensory weighting to other sensory or balancing organ. So this is really important to explain to patients. Sometimes it's need 1 month to 6 months, depends the technique and how frequent they do the exercise. Alright? So some people will ask me, can Zumba, can Tai Chi help my balancing? Can. But the most important thing, the best method, you have to do eye open, eye close. So, in conclusion, when you do pray, you know, the prayer technique, you have to do 30 times. For example, like turn right, left, 30 times, eye open, eye close. Okay? Standing on the back or standing on the sofa, close the light, and do the prayer movement. So that's the basic concept. And the best things, actually, the best tool for balance rehab clinic, if you want to start, is actually you just buy trampoline. That's all. And do the solat movement while standing on trampoline. But be very careful for fall. Alright? So you have to stand beside the wall, if you got guard, if you got belt, whatever. Okay? Okay then? So Alhamdulillah, I think all this experience is actually not from me. It was like I learned. I mean, I'm still learning with all these good speaker from UK, and also I'm certified from American Institute of Balance since 2015 by Professor Richard Tan. Thank you to my prof. So this is my journey for 16 years. Alhamdulillah. So I'm starting my innovation with a book. Then I'm doing my second innovation of cardio and stroke, and now this is my journey, last journey. This is what we call balance exercise solat. I call this is only prayer. This is we just modify. So I have a poster behind there. You can pass the table and you can see, because everyone know the pray, but we are structured. What kind of movement you have to start? The first movement you have to start for this therapy. This is what we call turn right and left. It's like a salam. Assalamualaikum. Because research shows that when you start the exercise with head and neck movement, is going to enhance the recovery. That's the reason. Alright? And actually, to be honest, this method is actually the method from customized cotton kursi exercise. And it was like suddenly similar with the prayer movement. Okay, so I just want to play this video. So how there is a sound. That you can say, when you can start standing. So this is one of the example, the movement that normally we ask patients to do, to open and also feet closed with eye open and eye closed. Because the concepts in the balance rehabilitation or body balance training using this five solat, eye open and eye closed is really important. Because when you close your eyes, the movement, for example, if you are standing and you are focusing to the pen that you hold, and you have to, for example, like move your head right, left, something like this, which is eye open, which is you have to do 20 to 50 times and increase the speed. So of course, when you are started, okay, Allahu Akbar. But don't do during pray. It's going to be batal. Okay. Yeah, you have to be real, real to the geriatric. They have a lot of misunderstanding. Okay, I think so. Every step of Alright, so basically, you don't remember anything, just salat. Where to start? Salam. That one I'm so sorry, because when you do things, you have to have a basic research and evidence. The evidence shows that when you started the exercise with the head and neck, you know why? You can realize a lot of vertigo patients, they are like robot. When they move, when they talk, they turn their body like this because they got some stiffness, pain in the neck. So this is why the most important thing, if you are dizzy, pray. If you are post-stroke, pray. That's all, simple. So life are very easy for us as a Muslim because we have the core model for rehab. Alright, so this is the next one. Okay, this is one of my latest innovation. Okay, no problem. You can go to my YouTube. You just Google Balaat Directory. You're going to get free access, free of charge. You can use to your community because in this directory, we just do the exercise using the chair. You know, because we want to prevent a fall. We want to prevent any complication. Alright, so basically, this is what we're doing. The solat, rukuk, sujud, and the revolution from a sheet of paper into a poster, book, manual, and Alhamdulillah, we do have in 16 languages. Arabic, Urdu, Bosnia, Turkish, yeah. So this is one of the study actually. So one of the study done, it shows that using the combinations of the, what we call, this is my student, Dr. Karen, ORS specialist from Ministry of Health. They did a pilot RCT. The pilot RCT for 4 years, and what they found is actually the combinations of the customized contribute C plus prayer is going to be a better result. So this is what they suggest. Dr. Karen is one of the non-Muslim Chinese, but Alhamdulillah, she willing to prove the model compared to the ordinary method that practiced in our or among our physiotherapists in Malaysia. So this is one of another, we are using P300 in our neuro department. It also concludes when using the prayer movement, the psychological improvement is much better. For example, like anxiety, depression, compared to the non-prayer. So this is our latest innovation. It's very simple because I want to show you. I'm just using this Google. It's very cheap. You can get from Shopee and you can put your phone and people can do at home. It's very simple. This is what we're doing. The latest innovation, what we did, and people can do at home. They don't have to travel to the hospital. So this is going to be same aim for the hospital home or physiotherapy home one day. They don't have to travel too much. Alright, so this is what we're doing. And this is also one of a good finding research. They shows that among the 16 respondents that use Totally Pray, it shows the prayer group and non-prayer group, it shows it's a better control of the speech, and also in terms of balance control are better for those who are in group of using prayer movement. Okay, so this is what we call that the best recommendation. Regular prayer practice is associated with significantly better dynamic balance. And this is all the collaboration. Alhamdulillah, I've been to Bosnia, Tuzla, Turkey, Oman, Dubai, and there is only 2 hospitals in Oman. Muscat and Izwah already use this model, and also in Bosnia, and yeah, that's all. They're using this because they are prayers and they have in the Arabic also that's different languages. So yeah, my last point. So the solat is actually able to improve balance and also reduce dizziness through rhythmic movement. So the most important thing, we have to encourage or inform our patients proper information before we left them, with a proper guide and proper knowledge how to improve their balance. Thank you so much.